So in front of me here I have a referral from your doctor that says I am to investigate on suspicion of glaucoma. Recently saw your practitioner and they have referred you accordingly to the clinic. So before we kick off with things, let's take a little case history. Now, is there any family history of glaucoma? Immediate family, please. Okay, are you diabetic? Do you suffer with hypertension? Cold extremities, either the hands or the feet? Any history of migraines? What age did you first experience migraines? Less than 10. The doctor has included your general history there, and that's medication. So it's just the amitriptyline. Okay, so we've got quite a bit to get through today. I have a record card here for recording all the findings. I'm going to be focusing on your anterior chamber and the angle. Do some grading there, courtesy of Terry Tarrant. And we'll be paying close attention to your optic nerve head there. So before we begin, do you have any questions? Okay, let's start with some tonometry. Here is the Perkins. So this pressure method may be a little bit different to what you've had with your optometrist. Your first step is to instill some lidocaine fluorescein into the eyes. It's going to sting a little, soon wears off, and not to rub your eyes for at least 25 minutes afterwards, please, if at all. Look up to the ceiling. Okay, try and look up again. Drop it in your left. I'm going to give you a few moments. Lidocaine. Batch number. Expiry date. And the current time. How are you feeling? Right, let's set up the Perkins. this sterile probe is going to make brief contact with the cornea. Your job is to look straight, breathe normally, and keep both eyes open. Okay, we have 22 on the right. So look at your left. Look straight. A little bit higher in the left, 24. So I'll record that down. Right, 22. Left, 24. Not too bad. I'll certainly know more once we've looked inside your eyes and done some further checks. Now let's try and get you set up on the slit lamp. Okay, I'm sure you've sampled the delights of the slit lamp before. Essentially, it's just a big microscope for checking the eyes. So, let's get ourselves set up. Just going to get the optimal settings. Okay, let's start with a Van Herrick's assessment. The light 60 degrees. Look towards this ear. And we're just going to focus on the limbal edge there. Okay, so we have a grade 3 angle on the temporal side. Let's just check nasally. Just try and look straight in the same direction. Okay, grade 3 on either side there. Let's have a look on the left side. Okay, try and look towards this here now. Grade 3 again. And the inner part, please. Just try and look straight. And we have a 3 there. Okay. Just sit back and relax a second. Okay, let's set up the test that we use to have a look at the anterior chamber with a special lens. This is Gonioscopy. Okay, so this is the gonioscope. It's going to rest against the surface of the eye for a few movements. It's going to feel a little bit wet. I'm going to apply some cupping fluid on the front. Okay, so bring your head back onto the slit lamp, chin on the chin rest. Okay, I want you to look straight straight ahead. Don't let your vision or fixation waver. Set up the correct settings on the slit lamp. That should be fine. Okay, if you're ready, look in this direction at all times. That's lovely. And then with this test, we can really and truly imagine ourselves sitting on the edge of the iris, looking at the angle in much better detail. See Schwabe's line and the trabecular meshwork there. Yep, looks to be a nice grade 3. Thank you. I'll set that up for the other eye now. Okay, let's look this direction best you can. Both eyes open, please. And let's look at the left angle. Lovely. That's fairly open. I'm going to give that grade 3 as well. Trabecular meshwork. Fantastic. So it looks as though you have a very good drainage channel in terms of openness. Okay, but we're going to check for signs of things that could block an open angle. Okay. Sit back and relax. So that was Gonioscopy. All over grade 3. Right. Grade 3. Left eye. So what we're going to do next is we're going to dilate your pupils. So make your vision a little bit blurry. It'll take about 30 minutes to work. And then we'll have you back for some more slit lamp assessment. So for us to try and hit maximum ocular dilation, we're going to use 2 types of dilation drops, acting on different muscles of the iris. So first one is trabeculoid. Just look up to the ceiling. Okay, how does that feel? Look up for the left one. Trabeculoid 1%. Batch number. Expiry date. And time. The second minim drop here, phenylephrine 2.5%. As I say, this is going to try and open your pupils up as wide as possible. Look up. Okay, one in the right. Look up again. Excellent. Right, okay, your job now is to have a seat in the waiting area. I'll call you back through shortly. And then I'll have a look at the front and the back of the eye in a little bit more detail. Welcome back. So you may be finding that your vision is a little bit on the blurry side at the moment. Fear not. This actually allows us to see very well at the back of your eye. So let's just do an anterior assessment towards this ear. You just hear me mumbling a little out loud. So let's have a look at the cornea. Thank you. Just scan across. Just looking at the endothelial layer. Looking for signs of Crockenberg spindle. Just going to have a look at the pupil margin now. I'll have to excuse the bright light. And then just the anterior chamber, looking for any evidence of pseudo-exfoliation. This is where the cells can release this kind of white material which can deposit itself in the eye. Okay, negative, good. Let's switch to your left. Try and look in this direction, please. Corneal surface. Signs of any Fuchs dystrophy. Maybe a little bit of pigment on the endothelium, one or two. Doesn't really constitute pigment dispersion. Okay. Keep looking straight, please. Looking at the iris surface. Pupil margin, and just back slightly the anterior chamber. Not seeing any evidence of pseudo-exfoliation of lip. Okay, so all in all not too bad there. Let's now focus our attention on your optic nerve head, using a special lens that's going to sit just in front of the eye. Okay, so you may find this test a little bit brighter. I have reduced the intensity of the light. I'm going to be asking you to try and look straight ahead for the right eye in this area. I'm just going to be holding this special lens in front of the eye, allow me to visualise the optic nerve and check for any glaucomatous features. That's it, not going to touch the eye. Okay, keep looking exactly there. Okay, just check the height of the optic nerve. So we have medium-sized optic nerve head, moderate cup depth, looking at the isn't rule, we just about obeyed, no signs of any bowed disc, peripapillary atrophy, possible on the nasal side there, minimal though. Looking for any focal notching, none seen. The CD ratio would estimate at 0.7. Excellent work there. Let's see if we can line up for your left eye. So I'll bring this here. Lovely. Just look straight. Alright, CD ratio 0.8, so a little bit more. Lamina cribrosus, quite evident. Possible bayoneting at 12 o'clock. Slightly deeper cup. Okay, you're doing a grand job. Isn't rule is disobeyed. So this left eye certainly looks a little bit more suspicious. We're looking for the signs of glaucoma. Okay, let me take those notes. Sit back and relax, please. Bowed, PPA isn't right obeyed, left disobeyed, notching, possibly in the left again. Certainly had some bayoneting around 12 o'clock there. Okay, I want to try and visualise the optic nerve now by performing some ophthalmoscopy. Right, so your vision should be quite blurry now, that's normal. Just going to kind of reinforce what we found. Just having a look in more detail at the optic nerve. Look off over my shoulder, please. A close-up inspection of the nerve once more. That must be certainly get an apparent closer feel than using the Volk lens. Just confirms things, thank you. Okay, for the left. Looking over my left shoulder. Yes, bayoneting and confirming the notch. Minimal PPA. Okie dokie. So we have what we need from today, thank you. sit back and relax. Okay, so looking at the findings, I'm highly suspicious of primary open angle glaucoma in your left eye. I feel that your right eye may be at risk of developing glaucoma also. Now, further action, we get you back in about a week to see the nurse to perform a visual field assessment. Now, that's the test where you're looking at the light in the bowl and you click your button when you see a flash of light somewhere in your side vision. Only when we've performed that test can I reach a clinical diagnosis. So, looking here, we're going to book you in for a week's time to perform that test, and then I'm going to have you back in to see me to discuss the findings and see where we take things. So that's everything for today. I'm going to let you go now.